Hello, this is Anne DeGheest from the Anne Insights channel on YouTube. Welcome. This is December the 4th, 2020. Today we have two videos we're going to discuss. The first one, we're going to discuss how COVID is going through the roof in the US, and we're breaking all the records. So you don't want to miss this part. And how Europe is bending the curve and is going to be reopening for the Christmas holiday a little bit more. While in the US, we're going more into more controlled situation there. In the part two, we're going to do a review of what we know and what we don't know about the vaccine and how you can avoid being infected. We're going to go a deep dive on the vaccination. When could you expect to be vaccination? What vaccine? What are some of the limitations? And we'll do a quick treatment update. So if you remembered, I'm not a doctor. I'm just have a lot of experience in healthcare. My description of my background is on the YouTube description of each video. And I'm like a Reader Digest. I am trying to summarize the information in a way that you can take better decision. And please help me transfer the knowledge and post this on social media. Thank you, and let's get the show going. Okay, now this is the first video, December the 4th, on epidemiology, and we are going through the roof. I'm running out of expression for the video every 2 weeks, so and allow me to explain what I mean by that. Worldwide, we are now at 65 million cases with 1.5 million deaths. The US has exploded. We are over 217,000 daily cases. If you remember, we were at a much lower number in a couple of months ago. We're now achieving 1 million cases every 6 days in the US, and this is the stunning part, 2,879 daily deaths. This is the level of 9/11. Europe is bending the curve. Great news on the European front. So we'll spend some time on that. In the second video, which you don't want to miss, I'm going to do a little bit of a review of what we know and what we don't know about COVID and how you can avoid being infected. And we're going to talk about what does the vaccination means? When could you get vaccinated? How is it going to work? What are some of the issues in the vaccination process that we're encountering? And we'll do a quick update on treatment update and the long haulers. So let's look now at what's going on with the virus. You can really see Europe is bending the curve. They've done an amazing job. As soon as they exploded here, they did some very strict requirement there across Europe. And we're going to see in certain countries have done an amazing job and really dropped it down drastically. The US, unfortunately, is leading North America, and that's going, of course, the wrong direction. So worldwide, since I saw you 2 weeks ago, we've gone from 66 million cases to 64 and 1.5 million deaths. And you can see America and Europe are leading the charge, unfortunately, in the growth worldwide. We are now close to 700,000 cases per day. We're going to probably pass 1 million cases in the coming months. And what's is interesting there, the mortality rate has gone up by 13% worldwide. The number of cases, because we have such a high base of 65 million, is only a 3% increase, but you're going to see the US is significantly higher than that. And we are number one in the world. And Brazil and is having a bit of an uptick, and India is clearly going down, so they will not pass us. So, whoops. If we look at Europe versus US, and this is the large Europe, you can see, unfortunately, both of us are being hit really hard in the number of cases we have had since we've reached 10,000 cases, kind of normalized there. So Europe, you can see, did a control of it, but then it exploded there, and then we never really had it under control, and we continuously to grow. This is the interesting part, is that if you look at the cases per million, so it's normalized by the population, you can see the US is one of the highest in the world. That's 542 cases per million. But look at the numbers of some of these other countries. We'll spend a bit more time on that. Massive drop in Belgium and France that had huge peaks. And then the two countries that really did not try to make a big effort in controlling the virus, which is US and Sweden, are of course the highest one, some of the highest ones on the case per million there. So let's take a bit of a deeper dive, and you can see that Europe as a whole, as soon as they did the breaks and they started limiting bars and restaurants and had curfews, look at how quickly it dropped. This is why it works. forcing people to wear masks, or at least recommending strongly that they wear masks, and decreasing the activities that are indoors in high crowds and poor ventilation there. You can really see how it dropped. It's an absolutely stunning drop. Look, I just picked Switzerland, Belgium, and France that were the worst there. These are very, very impressive numbers when they went from 1,500 to now a level around 400. So it does work. Uh, um, so we still have some hot spots. US, as you can see, is breaking all the records. This is the spring when we had a big problem in New York, and you can really see it's way, way above where we were. Brazil, that was controlling it, now has an uptick and it's at the level of its peak. So we have to keep an eye on Brazil. Again, two countries that were not coordinating their efforts on the COVID. Russia, despite the fact that they have their vaccine, the Sputnik 5, you can see is also having an outbreak. And Germany is the one European country there that, it's flat, but they haven't been able to control the curve. So we have to keep an eye on Germany. If you look at the case per million, the US 2 weeks ago was at around 400. And we were at the bottom here of the pile there. We have now climbed up to 657. So on the case per million basis, we've gone up 50% in the last 2 weeks. Now there are smaller countries which have small population there, that are ahead of us. But you can see as far as the biggest country, we are clearly leading the pack. And Sweden coming, shortly behind us there. So I think we do have to make a coordinated effort across the country and learn a little bit what has worked in Europe. So the positivity rate in Europe is still very high. Countries like the Netherlands that did not put any restriction are still very high. The Czech Republic had a big breakout, if you remember, like a month ago, and they've done a good job at controlling it. So you can really see the difference between countries like Belgium, which was a huge spike in that green color there, who basically were very restrictive there, and they were able to really bring down the positivity rate massively, from 30% to less than 10%. So good news. But you can still see from a mortality point of view that Italy, that had this big outbreak in the spring, is still leading, in the death per million there. And of course, Belgium, and the Czech Republic, all those countries, they are still pretty high. So let's talk about the case fatality rate. And just to explain what that means again, these are looking at confirmed case. So these people who have been diagnosed or have had a PCR test, and divided by the people who die, who are confirmed to have died from COVID. And worldwide, it's around 2.3%. 86% of the country are below 3%, like the US is. This is that light blue. But then you have countries like Yemen, where the welfare system is totally overwhelmed, where they have a 28% mortality rate, and Mexico at 9.5%. These numbers are impacted by how much volume you do in the testing. So if you don't do a lot, by definition, you have a higher mortality rate for the volume that you do. If you basically do a lot of testing of mild and asymptomatic, and of course the treatment have improved drastically in the last 6 months, so the mortality rate has gone down. And we need to differentiate that from what's called the infected fatality rate, called IFR, because in that one, we're assuming there's a large percent of the population that is asymptomatic that hasn't been tested. So you're going to see an IFR maybe 0.6 to 1%, with the CFR could be 2 to 3%. So it's easy to get lost in all these numbers, but I just wanted to have a quick, review of where we are. So in the US, the case fatality rate, which are the confirmed cases divided by confirmed death, you can see has been averaging, around 1.5 to 2%. Now, clearly, we cannot take into account any information about Thanksgivings there, because the data, is not fully reported there. Overall, the flu is 0.1% fatality rate. COVID is at least 0.6% infection fatality rate. And the confirmed case is 1.5%. So I just want to use this number there because people are arguing about that. The big worry, which everybody's talking in the news, Dr. Fauci and everything else, is that the hospitals are now stretched to the limits and they're going to get worse. And when that happens, the fatality rate does go up because you don't get the best care available, or you may not get access to the bed and you may have to be transported far away. So I wanted to discuss two interesting cases. And in China, they did a very good contact tracing of cases in a city called Qingdao. I'm not sure I say it right. And there was an outbreak. Now, the outbreak was 12 people to get a perspective there. But in 2 weeks, they tested 10 million people. This is what we need to do, is to do this massive testing. And the way they did it is called pooling. So you take all the sample of 3 to 10 people together, and if the sample is negative, you just go on to the next group of people. If one is negative and one is positive, then you test the people who are in that pool. So it's a way to really do rapid testing. We need to start doing this in the US. Then as soon as they identified there was a small outbreak, they quarantined people for at least a week. And then they did biweekly screening of everybody who's in a high risk group, like people in the ports. So in this case, they believe that the thing came from 2 workers at the port that were handling something that was contaminated, and then they start spreading. But this is the type of contact tracing that that they're doing, and that's how they've been able to control it in Asia. Another interesting story there was in South Korea, and this is a little bit alarming, but very interesting too. So you had this patient B that was infected there, and look at the distance. It's 15 to 21 feet. They were in an indoor restaurant. And then you had this case A and C that got infected, and they were only together for 5 minutes. And the lessons that we learned there is that when you are indoor, and this is why I think the restaurants and the bars have been really a dangerous place for contamination, is that the air circulation, the ventilation is the key driver. It is not the distance, it's the airflow. And they were able to go back and recreate the environment there and the speed, and look at where the airflow was. This is the 2 air conditioning units there, but the way the airflow was working, this person here that was infected basically had the virus spreading, and as a direct airflow, basically, unfortunately, hit these 2 people there. So again, they did the genome sequencing of the 3 cases to make sure they were exactly the same mutations. So this was not people walk into the restaurants and be pre-contaminated, they got contaminated in the restaurant. So these are the type of studies there that are very informative, and I think confirms that you really have to be careful with indoor restaurants. So what is happening in the US? We are breaking all the records in a way that's mind-boggling, honestly. So we had 2,800 deaths, 217,000 cases. These are massive numbers compared to where we were 2 weeks ago. We have now 14 million cases in the US and 277,000 deaths. So let's take a bit of a deep dive. You can see big pockets in California, Texas, and Florida, and unfortunately the Northeast. If you're in the Northeast there is a research in the Northeast, the whole New York, New Jersey area there is lightening up again. So since I saw you, we have added over 2 million cases. So we're at an average of 1 million cases every 6 days. You can really see it's going straight up. And we probably have to wait for Thanksgivings there because the data is not reliable there, but it's going straight up. And you can see that it used to take 44 days to add 1 million cases. Now we are averaging 1 million cases for the last month, 6 days for the last month. So that's going the wrong direction. What's worrisome is the death rate has gone up by 37%. And we had that surge, if you remember 2 weeks ago, the case had gone up by 35%. And guess what? 2 weeks later, it ties to the mortality rate going up. And so the good news, there's a bit of a slowdown there, but we have to see how much of that is due to Thanksgiving. And Thanksgiving is going to get an infection rate that is going to start showing up in 3 to 4 weeks after Thanksgiving. So it's going to be around just before Christmas time. So some states are really hit really hard. This is an interesting graphic from Johns Hopkins there. You can see South Dakota and North Dakota are really driving a lot of the infection rate per 100,000 there, and Wyoming and Minnesota and Utah. And the country is still the Midwest is where we're having a lot of issues there. And Texas is flaring up. Texas was not as bad. So unfortunately, it's really being driven by the middle of the country. The US has gone up, around, 5% in the last 14 days. But look at New York, 60%. And these are high population area, Massachusetts and Arizona, all big spikes. And this is the problem. California went up 43% in 2 weeks. And that's why today they have announced that pretty much most of Californians there are into a shelter in place for the next 3 weeks, and with major limitation in being able to travel and quarantine if you drive more than 150 miles. And this is across the country, big population state like Louisiana, Pennsylvania, Ohio. So although it has slowed down a little bit there, the numbers are pretty high in the growth rate. And the way to look at this is to look at the single day case record for each state. And you can really see that on a week by week basis, we continuously break prior records. And so we have lost control. There's no doubt about it. To get perspective, we're all being numbed by numbers that don't make any sense. Let me give you a perspective. On 9/11, which we went to war for, and the whole country was really shocked, we lost 2,977 people on that night, on that day in New York. This is what we are now losing on a daily basis. I pause here because this is the only way we can get a sense of reality. This is really, really serious. All of us, we have as a country, we have to get together the same way we got together after 9/11. It's a war against an invisible enemy. There is no Republican, there's no Democrats. We all have to help each other. And the magnitude of these numbers are unbelievable. So nursing home have passed 100,000 deaths. Around 40% of US deaths are in nursing home. And that's where you're going to see the vaccination rollout is going to be going to nursing home in the phase one. Regional cases, this is an interesting graphic. I put them side to side, and you can see that pretty much all different regions in the US are going up, but clearly the Midwest is the one that has been driving that explosive growth, but it's not unfortunately everywhere else. And you see the delay. Let's look at the South. You can see the delay in hospitalization, which is 2 to 3 weeks afterwards. You can really see that upsurge there. So I think the next several weeks are going to be really difficult. As a result of that, we've now passed the highest record ever of 100,000 people hospitalized in hospitals. And that's the worry that everybody's expressing, is that we're running out not of bed or ICU beds, although they're really tight, as we're going to discuss, but we're running out of healthcare workers. And that is why they expect the fatality rate to go up, because you're starting, instead of being one nurse per patient in the ICU, you're going to have one nurse per several patients, and that's always lower quality of care. So that's a very worrisome trend. So you can see significantly higher than with the prior two peaks we have had. And this is to go into more details. If you look at the ICU capacity there, you can see North Dakota is at 90%, Alabama is at 87%, number of beds occupied, all very high. As a rule of thumb, what you want to see is maybe 65% utilization rate, so that you can handle somebody who gets a heart attack or car accidents and all of that. And this is the big worry that happened to California. We popped in, we were never there. We had plenty of capacity there. Now we're at 77% in the ICU. So you can see most of the US, I didn't put all the states, most of the US now is way into the yellow and red warning area there. These are very, very high percent utilization. California is back up, and this is the big worry, is that if you remember a month ago, our positivity rate in California was less than 2%. We have tripled, close to triple the positive rate. That means we are having an outbreak in California. It's not that we're doing more testing, we're having an outbreak, and that's why you see a lot of the restriction that just got announced this week there. Number of cases is around 10,000 cases now, unfortunately, daily. And this is an interesting graphic, because you can see at the beginning they were doing an estimate of people, because we didn't have enough testing, and you were looking at people with symptoms there. Now I think we have plenty of testing there, so you can see that area there is getting narrower, and now we're having the true diagnosis of people that are not suspect but that have been confirmed. And this is what we don't want to see, is the ICU going straight up in California. And we had really brought under control, and you can see with the rise coming up with that 2 or 3 weeks lag that we talked about. From the demographics, the majority of the cases, 58%, are the Latino population, because they are the ones that are the essential workers. They live in high density housing, and unfortunately, through their work, get exposed in providing some of the services that we need. The white population is only 19%, but they have a bigger chunk. They have a higher mortality rate than the Latino population, which is probably on the average younger. If you look at what's driving the contamination, it's the young population. 60% of the people we diagnose are between 18 to 49. And unfortunately, what happens is that they pass it on to their loved ones. And that's what's driving the mortality rate for the people over the age of 65, which is the bulk of the mortality rate. But people do die, as younger adults. So you're not off the hook. It can happen. So this is a zip code that's interesting. You may want to take a look at it. I'll post it on the website there, and you can look at what's your infection rate. So California as a state has gone from 1% to 3.3% in the last month. Santa Clara, which we went into lockdown, is at 1.9%. But look at Imperial County. Imperial County is near the Mexican border in the southern part of California. That's 9% of the population is infected. So I think it's really important that when you try to determine the risk that you have to look at your zip code level. And there's several of the tools that I took 2 weeks ago. If you haven't seen that video, I posted some of those links there. You can see your infection rate and where you are. So in the Bay Area, we have triple hospitalization in the last month. And so that's one of the worry there. Some of the ICU at 93% capacity, depending on the hospital there. And we all went into a stay-at-home order that's going to be effective in a couple of days. So I want to wish you a happy holiday season. Stay safe. Make sure you wear a mask. Celebrate differently. Be very creative. And really be cautious there, because the next months or two are going to be really difficult. I'll probably see you just before the holidays. Stay safe, and please watch my second video.